When starting the expenditure reporting process for COP21 fiscal year 22 reporting, you will initially want to go to DATIM Zendesk in order to download all of the materials that you need in order to report. So I've opened a browser and I'm going to type in DATIM Zendesk. I'll click on DATIM Zendesk. And what we see here is a menu of different options. So when you're going to this website, you also need to keep in mind that DATIM is the online system where you will submit your expenditure reporting template. But DATIM is so much more than just expenditure reporting. DATIM is also where you would report your MER results, your HRH data. There's a lot of other data streams and a lot of other things that happen in DATIM. So there's these two entities that maybe I can clarify as well. So when you submit your expenditure reporting template, you will actually need to navigate to datim.org. This is the system where you will need to upload and submit your template. So this is the submission window. But for the resources and the materials, you will go to DATIM Zendesk. So just keep in mind that while we have a number of different options to choose from this website that offers resources on how to report in datim.org, it goes beyond just expenditure reporting. However, the two main pages that we're going to focus on is going to be DATIM training and tutorials and PEPFAR guidance. So we will first navigate to PEPFAR guidance if you are just starting ER for the year. And you'll see, as I mentioned, there's guidance information for multiple different initiatives, but we're only going to focus on expenditure reporting for this time. So I'm going to click on expenditure reporting. And now we have a number of different options on what to select to prepare for the reporting for this year. A good place to start is to click on what's new for COP21 fiscal year 22 ER reporting. You can scroll through the web page and read what is new here. Please note that there's updates regarding the DUNS number has been replaced by a UEI number. If you're having issues with the UEI, there's some guidance on what you can do. The updated guidance on subrecipient templates. There's been a few new error checks that have been added, especially considering the subrecipient change in the template. And then there's a note on a few things that are unchanged from expenditure reporting. So you can either review this in the website, or if you would like to download, you can also download the attachment and view it as a PDF and send to others in your office or other colleagues that will be working on expenditure reporting. So that's a good starting point, is the what's new. Now we're going to click back and see that the next link that we have is the actual expenditure reporting template. And we can see here at the top that the template was uploaded on September 6th. This is good to note just because every now and then, mostly at the beginning, there are sometimes errors in the template that weren't caught before this was posted on DATIM Zendesk. So I like to go to DATIM Zendesk and check to see when the last update was made. So just to make sure that I'm working on the most recent files. You can scroll down and see a little bit of information that serves as background for expenditure reporting. And then under attachments, we can click on the link and actually download the template itself. Now let's go back and see that there are other couple of links that are listed here under expenditure reporting. The first is a checklist for reviewing expenditure reporting data. Note that as of the time that this video was recorded on September 15th, there still has not been an updated publication of this information. So it's not yet current for COP21 fiscal year 22 reporting. I'm not sure when the material will be updated, But it's something to keep in mind that while as of September 15th, this information is outdated and relevant to last year's reporting, hopefully in the next week or two, we'll see an update. And once you see that 2022 date, you'll be able to then read the relevant information for this year's reporting. So that's a bit of a checklist, which is really helpful. There's another shorter document here called Monitoring Program Expenditures. And this is a little bit more of the operational background of expenditure reporting. We can see again here, as of today's date, it still has not been updated for this year's reporting. But if I were to check back in a week or two, this file should be updated. But you're not missing anything that is in this link or the previous page that we were looking at for this year's reporting. The most important documents as of today are the what's new, the expenditure reporting template, and then the last document that we will look at, which has been updated in fiscal year 22, is the financial classifications reference guide. Now, this document is updated on a rolling basis, so it's not necessarily always going to be updated in advance of ER reporting, but it is updated for fiscal year 22. So as long as you know, as you're going through this document, that there's not a later document, all of the information that is contained will be current for this year's ER reporting. At this time, I do not expect there to be updates to go beyond this January 31st, 2022 date, but it is helpful to check back often if you have questions on whether or not you're using the current version. So that's under the PEPFAR guidance section of expenditure reporting. So the what's new and the expenditure reporting template should be the first two documents that you should review and download and ensure that everyone in your organization is aware of, or everyone that needs to be aware of the expenditure reporting requirement has access to these two files because they are current and they are ready for dissemination. We're looking at the PEPFAR Financial Classification Reference Guide, and this is what we often refer to as our guidance document for expenditure reporting. And I would highly recommend that everyone download this file and become familiar with it in a general sense. This is a 74-page document. You certainly do not need to read all of it. And keep in mind that this is a reference guide for the entire PEPFAR framework, financial framework. So this is information that's applicable during our budgeting process to USG, to US government, as well as during the work plan process for reporting on the budget at the partner level, as well as for expenditure reporting. So if you are an implementing partner, most of this information is relevant for you for expenditure reporting, but this is information that is applicable to the PEPFAR financial framework, generally speaking. So some of this would be applicable to USG who do not report to expenditure reporting, right? But we set our budgets according to the financial classifications and we report our expenditures on the same classifications. So the information on how to do this with the different stakeholders of US government and implementing partners is all contained in this information, in this document. So you can see in a table of contents, as you're getting started, please take a look at the what's new for version 2.4. And then this is some information that is mostly relevant for background or for some of the US government internal financial processes. And what we'll want to go to is where the classifications begin. And if you'll remember with expenditure reporting, the three primary classifications are program area, beneficiary, and cost category. And so here are very detailed descriptions of all of the subcategories that fall under those three main categorizations. So you can simply click on program to get a little bit more information on the different site level program areas, different information on the beneficiary groups, et cetera. There's some definitions on the difference between direct service delivery and technical assistance as it relates to service delivery, non-service delivery. There are some definitional differences here, but really what this document is going to be the most valuable to you as an implementing partner who is completing expenditure reporting this year are the definitions of all of the different categorizations. So if I'm reporting on my expenditures for care and treatment, what are some examples of activities for HIV clinical services that fall under care and treatment? And specifically on the service delivery side. And you can see here, there's an exhaustive list of the many, it's not a fully exhaustive list, but it is a snapshot of a lot of the types of HIV clinical services, service delivery that is happening within PEPFAR around the world. So if your organization is doing any of these activities, then you will know that you can allocate the expenditures that are associated to these activities under this HIV clinical services service delivery category. Each section will also tell you any excluded examples. So if you are not quite sure whether a particular activity should go to one category or to another, in this case, there's some socioeconomic, psychosocial support activities that maybe the user isn't sure if it should go there or under clinical activities. This is where the excluded examples can be really helpful to not only give you an example of what those activities are, but can also guide you based on the activity where you should actually allocate the expenditures related to that work. So we had looked at service delivery for HIV clinical services. We often get a lot of questions on non-service delivery. What is the difference between service delivery activities and non-service delivery activities? Here are your examples. And so that's where you can see the difference between those two, where one may have a lot more relation to direct services to beneficiaries on the service delivery side, and one is more related to technical assistance or supervision and mentoring of healthcare workers or training of healthcare workers, et cetera. So this is just one example of one sub-program area, but this gives you an idea of how powerful this document is in helping you to understand not only the different definitions of each of the program areas and beneficiaries and cost categories, but also can help you to think about how best to categorize your expenditures. So this is just on the program area side. We scroll down all the way down to the bottom here. So we continue to go through the program areas and their definitions and examples. You can see now we're in the beneficiary section. So there's some different questions on what are the different age bands for some of the beneficiary groups. For example, how would you categorize adult women versus young women and adolescent females, for example? What are some of the associated programs with those different types of groups? And so you can see there's definitions here. Who fits the category of a priority population? And so there's some examples here. There's some additional notes. So this is not meant to be necessarily fully exhaustive, but it is to at least get you in the right ballpark of when you're selecting beneficiaries, what should I select? And then the last category that we have here is what we call cost category, or this is essentially what did you buy with your PEPFAR expenditures. And so again, the high level overview and the high level detail is here with these first 10 categories. And then this is where I think the document is very helpful to folks that take a look at this. This is where I think the document is the most powerful and the most useful to you, because you will need to be allocating your expenditures by these different cost categories. So for example, if I am recording salaries, where do I put the salaries for clinical workers or ancillary workers? Where do I put it? And so you have different examples of job titles that can help you to better understand which category you need to select to allocate the salary that you spent for those different workers. Same thing as we go down here, fringe is quite self-explanatory, but some of the definitions for travel, what is included in travel? Some of this may seem very obvious, but there are a lot of questions that we get on a number of different allocations and categorizations. The definition of equipment as per USG regulations, for example. So this is why this document is so useful, is that while we get a lot of questions on allocations, a lot of the definitions, not all, but a lot of the definitions and answers to some of your questions can be found here. And so one of the most helpful things that you can do in this document, if you don't want to have to navigate up and down to try to read every category, is you can do a Control F to find. Let's say I want to know where rent is categorized, under which category. Does that go under other, or does that go somewhere else? So I can Control F, I type in rent, and then now I can see, oh, it's the other contracts category where the expenditures related to office rent would go. Other contracts that are found under the contractual cost category. So definitely remember to use that Control F. That will save you a lot of time. So let's go back now that we've explored everything under the PEPFAR guidance section and go to the other section, and that's under DATIM training and tutorials. So again, we're going to click on the expenditure reporting section, knowing that there's other sections here on the work plan budget, on DATIM pivot tables, things like that. You don't have to worry about any of those files. Simply click on expenditure reporting. And again, we're only talking about once you've completed the ER template, now you must submit that template in the online system DATIM that we looked at over here when we first logged in. And so there are a number of different instructions and resources available to you in order to assist you with the submission of your expenditure reporting template once you have finalized the template. The most important resource that you will find is useful for you is the COP21 fiscal year 22 expenditure reporting instructions for IPs. And again, we can see here that this is a short description of what is contained in the attachment, which is right here. We can click to download that. And so you can get an idea of what this file will show you. It's the overview of ER, how do I enter mechanism subrecipient expenditures, completing the template as a prime, completing the template as a subrecipient, etc. So even if you are a subrecipient that spent more than $25,000 in fiscal year 22, and you need to complete an ER template, you are not required to have a DATIM account and submit your template in DATIM. You simply need to email your template to your prime partner, and your prime partner will submit your template in DATIM. However, you will notice that in this attachment, it will show you as the recipient how to complete the template, how to go through the error check process. If you're seeing any red flags, understand what some of the yellow flags may mean. So just because you're not submitting your template in DATIM does not mean this file will not have utility for you in understanding step by step how to complete each cell in the expenditure reporting template as a prime or as a subrecipient. So this is the template this is the file that I would recommend that everybody download and become familiar with now. Again, regardless if you will be going into DATIM or not, this will help you to better understand how to complete the template. So let's go back. And there are other instructions that have been posted as of September 6, 2022, that are DATIM instructions for prime partners. Again, with the new subrecipient requirement, you as the prime partner are responsible for submitting not only the ER template that represents the prime's expenditures, but you will then need to collect all of the eligible subrecipient templates and upload all of them at the same time in DATIM. So if I am a prime partner and I have 7 subrecipients that each have spent more than $25,000 in fiscal year 22, then I, as the prime partner, need to coordinate with 7 organizations to ensure that they have their expenditure reporting template, that they've completed it without any errors, that they've submitted it to, that they've emailed it to me by a certain deadline. And then as the prime partner, I will log into DATIM and I will upload 8 templates, 1 template for the prime partner and 7 templates for the subrecipients. So there will be a total of 8 templates in this example that I've given. So there's separate instructions here to help prime partners on how to complete this requirement, since this will be a change for prime partners from last year. And so you can see that we have a preview of what is going to come in this document, the instructions of the template, how to review the error checks, and then how to review and clear the DATIM error messages and all of the templates that you will be submitting. And again, this document has not yet been uploaded as of September 15th, but we do expect that it will be published shortly. So please check back frequently and often. And we would expect that all documents should be posted by no later than October 3rd, which is the official start of expenditure reporting. So we have downloaded the fiscal year 22 expenditure reporting instructions for implementing partners file. And again, this is a file that will be useful to both prime and sub partners. And this will assist you with the actual completion of the template, whether you are a prime or a sub. So just take a look in the beginning, a quick overview of the table of contents. We can see that there's very detailed instructions on the perspective of that prime and the perspective of the subrecipient regarding how to complete the template and how to review for the particular errors, depending on whether you're entering as either type. And then at the very end, there's a few slides on technical support that is available to you. So I'm just going to skim through the first couple of slides. Again, please just take a quick look at the overview slides, some of the background. There's some really useful information in here that will very likely answer any questions that you have on reporting as a prime or as a sub. So if I am a subrecipient and I am completing the expenditure template for the first time, I probably have a lot of questions. How do I start in the template? What is required in each field? What are some of the errors, etc.? And so this is the document where you will have all of your questions answered regarding your eligibility. If you are a prime partner, there's different scenarios. If you have subrecipients where some of them have spent more than 25 and some of them have spent less than 25, what do I do? So there's a number of different scenarios on how you would complete the tab, how you would complete the template based on the different scenarios that may apply to your organization or to your implementing mechanism. So please be sure to go through each of these scenarios if you're probably a prime and a sub, so that you know how to coordinate this with your subrecipients, so that they're very clear on the information that is required and how to successfully enter in this information. Now, if I'm the prime partner, just because the subrecipients are completing expenditure reporting templates for the first time, the prime partner, as has always been done in ER, will also need to complete an expenditure reporting template. And so even if you are a new prime partner to ER this year, there's still step-by-step instructions to help you better understand how to complete the template from the prime perspective. And so it's very similar to the instructions that we just kind of went through very quickly in the last scenario with subrecipients. So again, screenshots, the different options that you have available to you. There's also an explanation on some of the very common definitions and instructions, etc. So then as we're going through from the prime perspective, there's also a review that you can do as well. The template has a number of different error checks in it. If you have an error check in your template and you can see that it's red and it's giving you a feedback that you need to change something in the template, this is where you would want to go to better understand how to resolve some of those errors. And so the list of errors is also available here too, as well as the list of what we call warnings. The warnings are yellow. They will not prevent you from uploading and submitting templates. So if a template has yellow, that's indicating an unlikely intervention, or it's indicating something that you might want to take another look at, but it's not what we call a showstopper. You will still be able to complete, you'll still be able to go through the process of submission. A warning, the red box, is where you would actually be prevented from actually submitting your template, and those would need to get resolved. So we can see here, even on this screenshot, what's the difference between the red and the yellow? This is the document that will help you sort through that. And then at the very end, there's technical support that's available to you on DATIM Zendesk, the submit a request. If you're having any issues, this will talk you through how to submit a help desk ticket on DATIM Zendesk. So we have downloaded the fiscal year 22 expenditure template, and we're going to go through an example of how to complete the template if I am a prime and if I am a sub. So there's some basic instructions found on the first tab. Let's navigate now to the second tab, which is called metadata and error checks. And so this is essentially, regardless if you are a prime partner or a subrecipient partner that meets the eligibility requirements of spending more than $25,000 in the last fiscal year, in fiscal year 22, you will have to complete an expenditure reporting template. So this is the information that identifies your organization's expenditures. So let's start from the perspective of a prime implementing partner. So because you are a USAID implementing partner for PEPFAR, let's scroll down and select USAID as the federal agency. That is a federal agency that has the award with your organization. And the next information that you will need to type in is what is called your mechanism ID. This ID should have been sent to you by your AOR or COR or activity manager. And it's typically a 5 or a 6-digit number that essentially identifies the project that you're working on. So for right now, I'm just going to type in 1, 2, 3, 4, 5. And that was the number that was given to me identifying the project that I work on. So the next is, what is the name of the project that I work on? So I'm going to type HIV prevention project. And then this is where I will need to indicate if I am a prime partner or a subrecipient. Again, all prime partners must complete an expenditure reporting template. If you are a subrecipient that has spent more than $25,000, you must also complete this template. So for right now, we're going to complete with prime. And then for those of you that have completed expenditure reporting in the past, you have had to type in what was called a DUNS number, and that was essentially a US government vendor ID. The DUNS number has been replaced by the Prime Unique Entity Identifier, or the UEI. It is a 12-digit number that you should have received if your organization has been registered on sam.gov. So please go to sam.gov and either see what the UEI is for your organization, or if you have tried to register your organization and have had difficulties, There are multiple different workarounds in some of the guidance materials, particularly on the what's new for fiscal year 22 reporting, that can help you troubleshoot this field if you are unable to register and receive a UEI. So please refer to the what's new document on what to do if you do not have a UEI. Let's say that I do. This is a 12-digit number. So I'm going to just say 1, 2, 3, 4, 5, 6, 7, 8, 9. And then that's 12 digits. Okay. And so we can see already down here at the bottom that just because I had entered in 12 digits, that the UEI has been accepted in the template. There are no errors in the error check section. I have satisfied the data entry criteria. Now, this is not a real number, but it at least satisfies the 12 characters. And so this will not work for your organization if you enter in this information, but at least we know that we've entered in the right number of digits. Moving over to the second section of metadata. This is important, is make sure that as you are sitting down to complete the template, you are seeing fiscal year 22, COP21 in parentheses as the reporting period. You cannot use your expenditure reporting template from last year, from fiscal year 21. Each template is unique to the fiscal year. So one of the first things that you should verify is that, number one, you are looking at a reporting period of fiscal year 22. And let's look down here at the bottom, and we can see that the data set is expenditure. So now we know that we are working on the correct template. Now I'm being asked to enter in the prime partner name. I am the prime partner, so I'm just going to enter organization A. Your award number. So this is going to be unique to each organization's award. I am just going to type in a couple of different letters here, but again, it's going to be unique to each organization and the award that you have with the US government. So please seek that information out from your AOR or COR. And then last is going to be the OU, or the country or the region in which you are reporting your expenditures. So let's say that I am reporting as a prime partner on a project that's being implemented in Cameroon. I'm going to select Cameroon. And so now I've completed the metadata tab, and I'm ready to move on to the next tab and start entering in actual expenditures. So now we are on the expenditure template tab, and you can see as we go across the different columns, there are numbered for the different interventions that you will need to enter. And the first one that we're starting with is going to be program management. Program management is essentially the finance, administration, operations costs for your organization to implement your project. So what we're going to start with is there's two options. There's IM closeout costs, or there's IM program management. If you are an organization that is implementing a full year as normal, you would just simply select IM Program Management NSD. If you are an organization that is both implementing, let's say, for 3 months, and then 3 months later, you're going to go into closeout, then you would actually want to go down and select PM IM Program Management for the regular program management that you are incurring to carry out the activities that you have for 3 months. And then for the closeout, I would select PM IM closeout costs. Now, if you're an organization that is only going to have closeout costs, you simply can select closeout, and this will be the only column that you complete because it will strictly be operational and financial in nature. So the next is I will select a beneficiary group. And there's not strict guidance on this, but generally speaking, unless you are a KP only organization or perhaps an OVC only organization, the work of program management is not benefiting any particular population in the country of Cameroon. So what we're going to do is select non-targeted, not disaggregated, as the targeted beneficiary group for program management, because it just doesn't make any sense that your rental costs for your office would benefit adolescent girls and young women. So let's just go ahead and select the non-targeted, non-disaggregated. And then as we're going down the column, we simply just need to report then what the expenditures are for program management. So perhaps we have some salary information that we need to enter for our staff that work at the implementing partner's office. We have some associated fringe. I'm just typing in some random numbers here. We might have some travel that's associated, etc. And so you will simply go through and enter in each of the associated expenditures as they relate to program management. Now, let's say that this organization is not in closeout. Let's just flip this back to regular program management, because this organization is actually implementing activities and not closing out this year. So first, let's say that the organization would like to report on their expenditures related to clinical services, non-service delivery. So some of the activities that are related to technical assistance, supportive supervision at the site level. And let's say that this is at a particular facility where there are pregnant and breastfeeding women. So again, we'll simply just report on the expenditures that are associated with this, what we call intervention. That program area and beneficiary combination is called an intervention. So maybe there's certain staff that we're paying to do some of that technical support. Maybe again, there's some travel related costs. Perhaps there's some supplies added in there, etc. And so on. So you can get an idea of essentially how to populate this template. Again, that was just for the clinical services, non-service delivery. Maybe this mechanism also does a lot of general HIV clinical services, non-service delivery, not targeting any specific population. So we're going to go and select that non-targeted, non-disaggregated population again. And then type in the associated expenditures here. So you can see how to enter in the information as we go across the rows. Now, if we have any subrecipients that spent less than $25,000, we're going to enter that number right here. So there's one subrecipient that spent less than $25,000. We're going to type in subrecipient name here, subrecipient 1 as the name of the organization. Again, there will be a UEI that you will have to enter in here. Let's just say that, that's a real number. It's not. And then it's very similar to what we did above when we're looking at the context of HIV clinical services for non-service delivery for pregnant women. Did the subrecipient spend any money? Let's say that they did not. So we're going to leave this blank. But when we look up above again and think about the category and the intervention for clinical services targeting the non-targeted population group, this subrecipient might have spent money on travel, on salaries, some supplies, and maybe some other contracts. You do not have to disaggregate that subrecipient spend by these different categories in this example. You simply just need to type in one number of what that subrecipient spent. In this case, it would actually have to be less than 25,000. And so if it was above 25,000 in that example that I just erroneously typed in, if this partner had actually spent $250,000 on this one intervention for clinical services, service delivery for non-targeted, this sub-partner would need to complete a separate template. However, because this partner spent less than 25,000, they can simply just type in that combined amount here. And then let's say that we have completed the template, there's nothing more. Let's type in at least something for the prime in this area. We want to go back to the metadata and error checks tab to see if there's any errors that have been entered in the template. If we see anything, any of these boxes that are highlighted in red or in yellow, we'll want to correct that. So for example, if we forgot to type in a beneficiary group here, this is a red box. This was just an oversight. We forgot to make a selection. And you can see that now in the error check for has the intervention been defined with incomplete program area and beneficiary information? Yes, intervention number 3 has an intervention that has not been fully defined. This will cause an error upon uploading. So we simply will just want to correct that. And there's a number of different categories and reasons why this would happen. Let's say, for example, that there's a warning in the system. So for example, one of the very common warnings is when partners will sometimes have mostly service delivery expenditures. Let's say 90% of the expenditures are service delivery, and there's 10% that's non-service delivery. You can certainly break that out if you want. Look, we can do that here. That's drugs. There we go. Let's actually flip this back to the non-targeted, non-disaggregated. So let's say we're going to select the non-targeted, non-disaggregated for this group as well. And let's say that if this was 90% of the spend, and let's say there was maybe $100 here, it's not really necessary to break out the $100 if the majority of the clinical services for non-targeted populations is under the service delivery categorization. You can simply roll this $100 into the service delivery over here. And it's sort of just a bit of a limitation to understand that this should represent the majority of the expenditures, understanding that there is the option of service delivery or non-service delivery for each one of these categories. If it's a little bit more like 50-50 or maybe even 60-40, then you maybe would want to break that out again as we just had it. But if it's the majority are service delivery expenditures, go ahead and include that in here. And it's going to be understandable that this is going to be service delivery, but there might be some non-service delivery included. And so what that means is if we were actually to go and enter in some expenditures under the training category, you will see that this highlighted in yellow. And why did that happen? That's because generally speaking, we consider an activity like training to be a non-service delivery activity, but we've selected service delivery up here, right? So this is merely just a warning. And we can go over to our metadata and our error checks tab, and we can see that warning right here. It's considered an unlikely combination. And this will produce a warning upon uploading, but it will not prevent you from successfully submitting your template. You can leave this warning as is. If you really truly spent $2,500 on training, and it was for the 10% of the service delivery or so that we were talking about illustratively, you can simply leave this here and it will be no problem. So now we are going to complete the expenditure template from the perspective of a subrecipient. So remember, if you are a prime partner and you are managing subrecipients that have spent more than $25,000 in fiscal year 22, they will need to complete this template. And they will complete this template by selecting subrecipient on row 6, indicating that they are a subrecipient. So if you are a prime partner and you have 5 partners that have subrecipients that have spent more than $25,000, then you will need to have 5 subrecipient templates. It's 1 template per organization. And we can see that as we're completing the metadata tab. So this is one organization's expenditures, and we're going to essentially go through the same process and the exact same information as it's done for the prime partner. It's just you've indicated that you are a subrecipient organization instead of the prime organization. So again, we will, in this case, select USAID because we are a USAID subrecipient. Each mechanism has a 5 or 6 digit mechanism ID. If you do not know the mechanism ID, you can get that from the prime partner, but you will need to enter that number in here, indicating the number of the mechanism. That will also have an official name, and so you can type that name in here as well. And we've already indicated that we are reporting as a subrecipient. And then each subrecipient must also enter in the unique entity identifier information. So again, there must be some identifier for every US government vendor or every organization that works with the US government. So the prime partner has a UEI, or this unique entity identifier, and so the subrecipients should also have a UEI. If you do not know what your UEI is as an organization, you can check on sam.gov, sam.gov as in Victor, and that is where your organization should have registered and received that UEI number. If you have tried to register on sam.gov and receive a UEI and you are not successful, there is one workaround that you can do, in which case you will enter in the digit 1 12 times. So here we've entered 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And that's only if your organization is not able to successfully obtain your UEI. Next, we'll go down and enter in our organization name as the subrecipient. And then we'll go over to the right and now enter in more information about our organization. The prime partner is going to be the organization that you have your contractual relationship with as a subrecipient. So you will enter in their information here. And then the award number. And again, you can receive that information from the prime partner. And it's usually a combination of letters and numbers. And it is unique to what your project is. And so you can obtain that information again from the prime partner. And then the OU where you're reporting. So in this case, I had selected Uganda. So let's go ahead and search for Uganda in our drop-down menu. And there we have our metadata tab completed. And I mentioned this for the prime partner, and it's a reminder for the subrecipient. You need to be sure that you have fiscal year 22, COP 21 is the reporting period. The data set is expenditure. And if you're a subrecipient, you did not have this option last year. So this is usually a pretty easy way to ensure that you're not working on an older template like the fiscal year 21 template. You cannot reuse old templates. But even if you tried to use the fiscal year 21 template, you wouldn't have this option to select subrecipient anyway. So that should tell you that you're working off of the old template and you need to download the new template from datim.zendesk.com. So now we're ready to enter in our expenditures into our expenditure template tab. Similar to what the prime partner will do, you as the subrecipient or the subpartner will need to enter in what your program management costs are. And you'll select program management, non-service delivery. In almost all cases, unless this is a KP specific award or an OVC specific award, you will select the non-targeted, non-disaggregated. And this is where you will enter in your information of the expenditures related to program management. So this is basically all of the operational costs for your organization to implement the activities. So your finance, admin, legal staff, the amount would be entered in here, whatever that amount is for salaries, just making some numbers up here, whatever that may be for fringe, and then any related other cost categories here. If you do any operational or administrative or just other travel, things like that, you'll just go ahead and continue to work down the column and note what is related to program management. And one quick note about program management is it is often confused as a term with people who are actual managers, such as an activity manager or a technical manager, or even someone with the title of project manager. Any individual that works with the technical activities that are being implemented, the salaries for those individuals should be in the interventions and the subsequent columns. This column is really only reserved for those staff and for those operating costs that are for the organization to implement the activities. All of the expenditures related to the activities will be in these columns here. And so I would suggest that you work in collaboration with your prime partner on what should be selected as your different interventions. So perhaps as a subrecipient, you want to report on what your expenditures are for care and treatment. Let's say that you do a little bit of work in facility-based testing aimed at, I'm going to stay with females non-disaggregated, and then maybe a little bit of prevention activity as well. And so we'll enter in some of this information here. And then again, when you think about what your organization's expenditures are related to clinical services, non-service delivery aimed at females, you'll enter in the corresponding information here. And you'll just go down the row for wherever it is applicable for interventions. So you may wonder why, when we typed in this expenditure amount for this intervention, the cell turned yellow. And what a yellow highlighted cell is telling us is that there is a warning. There is something that you should go back and investigate to make sure that it is correct. Now, if you're looking for a full definition, it's a full set of the definitions and explanations of the errors and warnings in the expenditure template, you can download under the DATIM guidance section on datimzendesk.com. The instructions for IP users will list out every single warning and explain why that's listed as a warning. In this case, personnel for healthcare workers is technically categorized as a service delivery activity. These are healthcare workers, and the ancillary work, you can see full definitions of what job titles and what specialties fall under the healthcare worker ancillary category. But what we've selected in our intervention is a non-service delivery intervention and a non-service delivery program area. So what the template is saying is that we have selected a service delivery. We're reporting expenditures for service delivery staff under a non-service delivery intervention. That's okay, and that's why this is a warning. Let's say that in the example of this partner, you do 85% non-service delivery activity and 15% service delivery activity under care and treatment HIV clinical services. We could make another intervention that lists out the care and treatment service delivery, but that's another intervention that's another column that we would have to fill out. And if we consider that only 15% of our care and treatment is going to be under this column, and 85% of our care and treatment is going to be under this column, it's okay in this case to combine them into just one column. And so we understand that it's possible that there are some service delivery expenditures that are mixed in here, and we would rather have these combined than show a very small amount in this column for, $5,000 or $10,000 or $100,000. Maybe if this was a little bit larger, but if this is essentially a very, very small amount of money, just go ahead and combine that with your other care and treatment or your other program areas. And we just have this understanding that this is not exact and precise non-service delivery. and service delivery. It's primarily non-service delivery. And again, that is just because, as you can see, the expenditure template technically allows you to enter 35 interventions, but that can get pretty complicated when you start to think about all of the expenditures in your program. And if you really start to disaggregate every program area, every beneficiary, and do that at the service delivery and non-service delivery level, you would be very, very far out here toward 35, if not more, interventions. And not only is that just a lot of work for a partner to have to complete this template, but then again, as I said, we're really just seeing columns that may have $2,000 or $5,000. And that it's good to know that there are expenditures that are service delivery related, but we don't need to really drill down to the $2,000 or $5,000 or sometimes even $10,000 level, depending on how large the mechanism is. It's okay to just combine. So we can see here that this is yellow. This is just saying, wait a minute, before I submit my template, am I sure that this is how I want to categorize this? And as we talked about, yes, I know that 85% of the work that we do is non-service delivery. This is a little bit of that service delivery mixed in, but this is okay. I'm still ready to submit. I'm confident that this is still correct. Now, if we had a red box, as we see here, this is what is called an error. And this will completely prevent you from successfully uploading and submitting your template in DATIM, right? So in this template, it's required that you have both a program area and a beneficiary. If we only have a program area and then we have our corresponding expenditures down here below, and we haven't entered in our beneficiary, then we have an incomplete intervention and an incomplete reporting of expenditures. And that's what this red box means. You will not be able to submit this particular subrecipient template until the subrecipient fixes this beneficiary and adds it. And now we can see the red box goes away. So if you are a prime partner and you are collecting templates from all of your subrecipients, they will email them to you so that you as the prime partner will upload the template. I would suggest that you open each subrecipient template and make sure that there are no red errors in the template before the time comes for you to submit in DATIM. If you are a subrecipient, I would strongly suggest to make it easy on your prime partner and to do that review as well and make sure that there are no red errors in your template before you email that template to your prime partner. And I'm going to take this away again one more time so we can see that error, because if we go back to the metadata and error checks tab and we scroll down, here's where we can see where our error and where our warnings are. And then you are not only the error and the warnings are explained, but then you're also given instructions on what you need to do in order to fix and clear the error in this case, and then also just better understand what the warning is in this case. So again, an error will prevent you from successfully uploading and submitting your template. This needs to be resolved. This needs to go away. And we'll do that right now. We'll select a category. And we can see that error went away. We no longer have our red. We have one yellow, and that's okay. We reviewed it. We know that it's accurate and correct, and we're ready to email this subrecipient template to the prime partner. The prime partner will review, and then the prime partner will say, yes, I agree with that. I am ready to upload and submit this template on behalf of the subrecipient.